We just don't want anybody else coming in here.
Mom is coming.
Unless you tell them.
Correct.
How you doing, Alex?
I don't know.
What's wrong, baby?
What? I don't know.
Come in and have a seat. I'm going to go over a few things.
You want to talk to me, hon?
I want water. Water.
You have to wait until he gets home to have something to eat and drink. It's normal for them to feel that way. He has gauze in there.
He's got a lot
now,
of gauze
so,
and stuff.
Yeah, he's got gauze.
What does it look like?
And
It was okay. You got dry blood, but that's normal.
I
That's normal.
don't care. I don't feel nothing.
Alrighty, so whenever you get him home, if you could go ahead and get him something to eat, coat his stomach. Now, did y'all get prescriptions the last time y'all were here? Prescriptions? No? Okay. I'll check on that for you. They wanted to give you this from up
That's
front.
that claim thing. Yes, yes, yes.
Okay.
What does that say?
I'll check on the prescriptions for you and get those printed out, and that way you can get those filled at the pharmacy. As soon as you can get those, go ahead and give them to him. He doesn't have any allergies. to
What
the
prescriptions
medication.
for what?
Well, he's going to need an antibiotic, and he's going to need a pain medication.
Now he is allergic to K-Flex.
Okay. I'll see what Dr. Smalley says to give him, and we'll get something printed out as far as an antibiotic.
Well, what's he going to give him? Vicodin?
I'm not sure. It depends on his allergies.
Mama, I'm tasting blood.
Let me see your gauzes. Does he need these replaced yet?
Yeah, I can change them before
Do you
y'all
mind to
leave.
do that?
I
'Cause
changed them right before we came down, but right before y'all leave, I'll change them again for you.
Okay.
Yeah, that's okay.
Now, on these gauzes, are we getting some gauzes? Is that it right
Yeah,
there?
that's it right here. Go
Let
ahead
me
and
ask
send
you
that home.
something. Let me. I know he's got 4 places. So do we just do? I don't want to make a mistake or have too much or too little. 1 gauze for each tooth, like this.
What you're gonna do is just fold it up just like you did just now. Fold it up like that.
Yep.
One on this side and one on this side, and you're gonna check it every 30 minutes.
So it's not on top where the teeth were, but on the side.
No, you'll put it right there. He may have just moved it around a little
So
bit.
basically, it's going to be where the teeth were.
Correct.
So he'll kind of almost bite down on it.
Exactly.
Okay.
Okay.
Yep.
I'll put that back in there for you.
And what is this right here?
And that's socket gel. That's going to help with the healing. So you're going to put that on there a couple of times a day.
For how
Okay.
long?
Just until it's gone. Over the next couple of days, you'll put that on there. Okay?
2 days probably.
2 or 3 days, yeah.
And
Just
how
wanna
much
do
do you put on?
A pea-sized amount. Pea-sized amount, very small.
A pea size on each one.
Correct.
Okay.
Okay.
And that's twice a day?
About 2 to 3 times a day. And so when you get him home, go ahead and have him eat something soft and mushy.
Oh boy.
Here, let me help you.
I'll just write it on here.
All of the instructions are on that piece of paper. It'll tell you exactly what to do on there, okay? And,
Can you have that medication sent to CVS in Pleasant Ridge?
I
Yeah,
can,
what medication?
She said she's got to have medication.
yeah, let me check on that for you, okay? We normally don't call in prescriptions because we've had trouble with the pharmacies.
We can just run
But
it
I
by. It
can-
won't take that long to fill.
I can ask them up front and see what they can do, okay?
Oh my gosh. We can run it by there. Don't worry about that.
So instructions are there. Just feed him something soft mushy, and that's going to be, excuse me, that's going to be for the next couple of days, about 3 to 4 days. You'll want to stick with the soft mushy diet, okay? If he wants to take a nap, that's fine. Just have him recline in a recliner or prop up with some pillows. Don't let him lay all the way flat until he goes to bed tonight.
Okay.
Okay?
And how on the gauzes? How many days do we do that?
You're not going to do it for that amount of days. It's probably going to really start to lighten up tonight. So as soon as it starts to lighten up and it's not soaking the gauze, then you can discontinue use of the gauze.
So maybe 8 hours?
Everybody's different. I can't pinpoint when he's going to stop bleeding.
Well, I'm telling you why I'm asking, because it's got that Bob Willenbrand's.
Okay.
And that's why I'm asking. This is a really important
Okay.
question. Because I need to know what I know you can't say exactly, but what's
Yeah.
the average time to bleed? Because I'm going to start him on his medication as soon as we get home. So, because I gave him the pre-med,
Right.
you understand how it works.
Yeah.
Right. So I'm asking you, what would be too long?
I would, I mean, what time is it now? Like,
What time is it, Nick?
1:37.
1:37.
okay, I mean, here this afternoon, this evening, maybe about 8 or 9 o'clock, right before he goes to bed, it should really start subsiding.
Or we almost don't have to check. It's just like every once in a great while. Okay, gotcha.
So,
Gotcha. Okay.
I mean, especially before he goes to bed, it should.
And you
really
put
start.
you put this gel on. You change out the gauze. You put the gel and then the new gauze.
You probably don't have to do it every time you change the gauze. Just
3 times a day, more or
about 3
less.
times a day.
Okay.
Yeah.
Mama.
You don't want to overdo it with this.
Okay.
I'm gonna tell you, God, I'm tasting blood.
I'm going to change them for you, bud. Okay, I'm going to change them right now.
I don't want you to throw up.
If you'll go ahead and sign this sheet of paper for
Yes,
me.
ma'am.
Just saying that you're taking them home.
Did they take his blood pressure? Do you know?
We did, and we monitored his blood pressure the entire
It's
time
okay.
we did surgery.
Yeah, he's got borderline hypertension.
Okay.
So I just want to make sure. Thank you so much.
You're welcome, no problem. Go ahead and open the lab for me, bud. You see, and this right here is normal
Okay.
for right now.
And
Okay.
a good time to change it out.
Yes.
Okay.
Yep. See, and
Good
on
for
that
you,
side,
Alex.
it's not even it's not even
Yeah.
stuff in the entire
Yeah.
thing. So that's good.
I'm gonna watch you put
Perfect.
this in. Make sure I do
Open for
okay.
me. You just want to stick it right back there, like so.
Where you can
Right
kind
over
of
that.
bite on it cushy.
Yeah,
Okay.
because as long as you
Now,
put,
did they put that gel on yet?
yes, we have.
Okay, so we're
Mhm.
okay for
Yeah,
that.
so
okay.
we're good right now.
All right.
Just same for over here. Just stick it right back there, and he's
Can
gonna
he
put pressure.
gently brush his teeth a little bit to get the blood off?
Not today.
Okay, just rub it then?
You can do it with a wet gauze or wet paper towel or
Okay,
whatever. Just
all right, okay.
do that. That'll be fine.
Right.
Just no brushing tonight, and
Okay.
just start that back up tomorrow morning.
When could he, I know you say the soft foods is advisable, but if a person was doing exceptionally well, when's the soonest they could have more than soft foods?
I would say you want to leave more than soft foods.
Yeah.
I would wait at least 2 to 3 days.
Wow, okay.
So I mean,
Okay.
especially with the being as impacted, he's got sutures, he's got stitches on each site.
Are they dissolvable?
They are dissolvable, so they'll go away as he heals. But we
Okay.
don't want a lot of pressure chewing.
Okay, 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 gotcha.
Okay.
And does he need to return to Dr. Smalley or only if he's got problems?
Only if he has issues.
Okay.
Okay.
Okay, and do you have an emergency number? Because Dr. Turner's gal didn't call us back 3 different times
Oh,
when I
wow.
left. So are y'all
Okay.
pretty good about returning calls?
Yes, ma'am.
I mean,
They
I hope
have
that
a-
doesn't happen.
Well, we have a call log. If y'all call and one of us is available, then they'll get one of us right away. If we're not available, then they'll write us
But
out.
let's say
We
I'm
have
calling
to-
at midnight. He's bleeding.
Oh, well, you can reach Dr. Smalley. Can
How?
reach that phone number that's on there.
Yes.
Well, call to this office, but it'll also on our night call, when we switch over to the
Yes.
night calls, it'll give you his number to where you can reach him directly at home.
Oh, the recording?
Yes.
Oh, so I can actually reach him at home.
Yes, you can.
Okay, all right, okay. And does
If it's something more severe, then certainly we suggest that you take him to the emergency
yeah,
room.
I know what you're
But
saying.
if it's,
We'll go home.
Yep, okay.
let me
That's-
get him. He may want to see him before y'all take off.
Oh, that'd be wonderful.
Um,
Doctor may want to see you.
Okay.
Let me just
Put
make
your head
sure I'm
back,
not
sweetie.
forgetting anything here.
And he can't recline for how long? Till
Well,
this evening?
You'll want to have, it's okay for him to recline, just not
Head
lay all the way
flat.
flat. Head
Gotcha.
flat until
Why
tonight.
not?
Well, honey, that's just the way it is.
I like going far.
I know, honey.
Yeah, but
We
you
don't-
need. This is one exception that you need to listen
Yeah.
to the doctor.
Okay.
Okay, go get him and we'll.
And no straw. I already told him no straws and no spitting. Okay. And
Okay.
warm salt water rinsing. Start that tomorrow.
How often is the warm salt water?
You're gonna want to do it at each time he eats something. Make sure
Before or
that you keep
after?
it after. Keep it
Okay,
clean.
hold on a second.
Those instructions are
No,
on
no,
there.
listen to me. Warm salt water after eating.
Yes, ma'am.
And what's the concentration of salt? A teaspoon to a
I
tea
think
glass?
it's a fourth of a teaspoon.
Is it on here?
Yes, it is.
Let's look. Oral hygiene.
Half a teaspoon of salt with one cup of water every 2 to 3 hours.
After 24 hours.
Mm-hmm.
Very good.
So you want to start that tomorrow.
Wow,
I'm
okay.
gonna go home.
Okay, I'll write all this down
I'll go
for you,
get him.
Alex, where it's easier to read.
Okay.
Okay, she's getting him right now.
What?
It's a lot of stuff to remember. But you recorded it?
I don't know what it's like.
You what?
I don't know what it's like.
You don't know what it's like?
It has to think.
Oh, honey, I know you got that anesthesia, and that's normal. That's normal. Believe me, that's
I'm
normal.
gonna go cool the car. Why can't you get the thing called in? If it's not called in, then you go there this 30, 40 minutes.
It's not 30, 40 minutes. It's simple Vicodin, a prescription, Nick, and usually.
Yeah, hours behind. That's 2 trips, and if it's called in, it's just sitting there.
All right.
I'm so bad, so bad.
You feel bad?
I'm home now.
He wants to go home. He wants
I know, baby. I know. The doctor just wants to take a quick look at you.
I want to lay down flat. No, I can't
there's
lay down
one thing
flat.
you have to do.
I gotta sit up.
on the blue chair.
You gotta start taking that medicine as soon as we get home.
Oh, shit, my arm will do this.
Cool down the car, okay? Because he's not feeling good.
Yes.
I feel whoopee.
What?
I feel whoopee.
Whoopee?
Uh,
What's whoopee mean?
what's it?
Woozy?
No. Whoopee.
Wobbly?
Whoopee.
Whoopee? Sleepy?
No, whoopee.
What's whoopee mean?
Do something.
Goofy?
No,
Oh,
get going.
goofy? Well, you are goofy because you had that medicine, son.
Stupid medicine.
Well, they had to do it.
No.
Did you remember going out? Did it tell you to count backwards?
I wasn't feeling well. This is laughing gas. I'm like, haha.
Did you get you got an IV too, though, didn't you?
Well, hello.
Hi there.
We only stuck him once, and he did great.
I know you're a star.
Was it easy or what?
At
I fell
Cook's,
sick,
it
so I
took
don't know.
4 times to get that infusion.
That's unbelievable because he's got great veins.
Listen, I wanted to take over myself, but they wouldn't let me. It's like, oh, and she wouldn't stretch the vein. They roll, and she wouldn't pull on it. I was like, oh God, he's
Where'd your
not.
right go?
I'm right out here. Where's my cards? It's right out there, I think. Well, wait a minute.
Chin up for me. Let me make sure. Chin up, chin, 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 chin.